Sepsis, a word that sounds so simple, but it is one of the deadliest medical emergencies known worldwide. What is sepsis? We will break it down today. I am Dr. Namrata Agrawal, an ICU specialist, and very interesting and one of the most important emergency that we will be discussing. So sepsis is a life-threatening condition. Whenever there is an infection, our body produces immune response to fight off that infection. But in case of sepsis, that immune response goes into overdrive and starts to damage our organs and tissues. So whenever there is an overdrive of immune response, then we say that patient has landed up into sepsis. So any infection, any patient, any age group of patient, any race of patient, religion of patient can go into sepsis. And the important things that we need to watch out for is whenever patient has fever, but sometimes they may have low body temperature as well. So some patient may become hypothermic, they may be cold to touch, patient may have high grade fever, patient may have difficulty in breathing, rapid heart rate, rapid respiratory rate, patient may be producing less urine or urine color has turned dark or urine is not coming out, the blood pressure of the patient has gone low. And these are all the warning signs that patient is going into sepsis and they have to come to hospital immediately. So any type of infection like infection of the lungs, infection of the kidney, infection of the brain or infection of the skin, they may produce an intense immune response, an abnormal immune response, and the patient may go into sepsis. So sepsis happens because of this abnormal immune response, but what happens is the toxins which is produced by the bacteria and our body causes vasodilatation. That is, the veins inside our body becomes dilated and stagnant. The blood flow inside the body gets stagnant. So all the organs and the tissues are not getting adequate blood which supplies the oxygen and the tissue starts to die. Whenever there is a tissue death or a cell death happening, then there is an abnormal product which is formed which is called lactate. Our body produces normal amount of lactate daily, but it has to be under control. When it goes out of the control, it becomes a poison and the lactase hampers the blood supply to the tissues and it goes into a vicious cycle. So patient may have come up with an infection of a single organ, but they may go into multi-organ failure very fast. Like the patient has come with infection of the skin, which may be called as necrotizing fasciitis or an cellulitis. But abnormal immune response can cause the body to not provide oxygen to all the major organs and they may come to us or they may land up with kidney failure, heart failure, lung failure or even issues with the brain or brain swelling. So sepsis is not to be taken lightly. Even a simple sign of infection then you have to consult the doctor immediately. Also, whenever patient is in sepsis, there is a golden hour that we say that the patient needs to come to hospital. Blood cultures needs to be taken. Patient needs to be administered with broad spectrum antibiotics. Patient needs to be given fluid, lots and lots of fluids immediately, so that the blood circulation and the blood volume inside the body is maintained, and patient needs to be admitted in an ICU immediately. Sometimes patient may require organ support in the form of vasopressors, that are the medicines which will increase the blood pressure whenever there is a low blood pressure. Patient may require ventilator support, patient may require dialysis, and patient may require prolonged ICU stay as well. So sepsis sounds simple, but it is not simple at all. ICU people are very much trained in handling this sepsis. We take a multidisciplinary team with us. We involve all the specialists who are required to deal with the patient's sepsis. Sometimes source of sepsis also needs to be controlled, source of infection. That is, if there is an abscess or a pus forming inside like a kidney. So the surgeon may need to do a surgery to drain out the abscess. Sometimes whenever there is a cellulitis, that is infection of the skin, then the surgeon may need to cut that part of the skin and take out all the pus or the infectious material from inside. Similarly, if the patient has got sepsis and necrosis of a limb, say the diabetic patients who may be prone to get diabetic foot, then sometimes it may need amputation as well. So it is not a simple condition, it is a serious condition. Be aware of sepsis and help us fight the sepsis. Thank you.